talk to. That's controversial. I typically don't recommend much calcium. That's why I put question marks on this list. I typically don't recommend much calcium because the question is there a proper ratio of calcium to magnesium? Traditionally, first of all, most people don't even know that there is, okay? Traditionally, the ratio is thought to be 2 to 1. Okay, that's what's traditionally thought. So 2 parts calcium to 1 part magnesium. However, recent research suggests that the ratio is actually 1 to 1. And I actually am in the camp that it's 1 to 1. So is calcium deficiency a major problem in our society? I think not. The answer is no. However, we're led to believe that because everybody's supposed, especially all the women in the house, are supposed to take calcium, right? Say calcium, calcium, calcium. Well, guess what? We lead all industrialized countries in hip fractures, yet we eat the most calcium in the world. We live in a dairy state, yet if you go to any one of these hospitals, their main driver are hip fractures. Right? All these people are eating cheese, they're drinking milk, but they're still getting hip fractures. Why is that? Because calcium is not the primary cause. That calcium deficiency is not the primary cause. The primary cause is actually a number of things, but the least of which is an acidic body. An acidic body. Yes?
So we talked about things that can contribute to you having low minerals, or like the stomach acid having a role to play in anything, but are there actual outside factors that you can tell us about that cause you to use up the minerals more so that you're depleted?
That's exactly right. Let's talk about that now. It's a great segue. Number one, stress. Stress is huge, okay? So I was an expert witness yesterday for a patient, and I noticed something. I noticed it immediately. I had a big breakfast yesterday morning, and typically not a problem, usually hungry by lunch. Well, this deposition went for 3.5 hours. I was on the stand for this patient, 3.5 hours. Just getting hammered by the attorneys. Okay, 6 of them. It was fun. I noticed something yesterday. I noticed that I had trouble eating dinner. I woke up this morning, I still felt like I just eaten. And that was due to what? Stress. When we have stress, that lowers our stomach acid levels. Why? Because the body's thinking, I'm running from a saber-toothed tiger. Right? Why would the body put energy into digestion if I'm running from a saber-toothed tiger? Right? It's going to put energy where? To the heart, the muscles, right? So it's going to shut down the digestive system. So stress is huge, huge. The other factors that cause what we call low stomach acid and or demineralization. Everyone understand that fancy word, demineralization? What causes that? Eating a diet that is too acidic. We have to understand the concept of acid and bases, or acid and alkaline. Okay, everybody in this room should understand this concept, and that is foods that are rich in alkaline-containing substances are fruits and vegetables, period. Almost everything else is acidic. Doesn't mean that you shouldn't eat acidic foods, including beans, grains, etc. It just means that the body wants a balance, and it wants to be slightly alkaline. Okay? It wants to be slightly alkaline. And what does slightly alkaline and acidic mean, essentially in plain English? It is voltage. Think of it as voltage. Okay? You get higher volts from more alkaline foods. Volt means energy, right? So you get more volts, more energy with more alkaline-rich foods. Our body wants to be slightly alkaline. So we measure that in scientific terms with something called pH, right? So if we check our blood, pH is going to tell us whether we're alkaline or acidic. Water has a neutral pH of 7.0. So that's why we can drink it and it doesn't taste acidic, nor does it taste alkaline, right? Unless you live in some community where it's one or the other. Water has a pH of 7.0. Our blood has a pH of 7.4. 7.4, that is slightly alkaline. Degenerative diseases, any and all degenerative diseases, heart disease, diabetes, cardiovascular disease, blah, 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 are all related to acidic body, acidic foods. Everyone understand that? So, the minerals, whenever we eat, let's say someone drinks a soda. Someone drinks a soda. Soda, is that alkaline or acidic? Acidic. So alkaline and acidic. Soda is acidic. Is it little acidic or highly acidic? Highly. Okay, so we want a pH of what? 7 point what? 7.4. Water is 7.0, and that's neutral. Anything below 7.0 is acidic. Anything above 7.0 is alkaline. Okay? Soda is highly acidic. So if one of us takes a can of, let's say, Pepsi, and we drink it, our pH in our blood goes down to pH goes down to 2.2. How do we balance that? How do we balance that? The body cannot exist, cannot function unless that pH is 7.4. So you need more alkaline containing substances in the body to pour into the blood. Everyone understand that? Okay, so you just have soda, gulp it down, pH goes down to 2.2. Okay, it gives us energy, right? Because it has a bunch of sugar and salt in it and all this jazz, okay? Suck it up, great, got a boost of energy, caffeine in there. However, pH just went down. What does the body have to do? It has to get that pH back up to 7.4. So how does it do that? It has to dump minerals into the blood to keep that pH of 7.4. Which minerals does it dump in? What's the first one? Calcium. Calcium is a highly alkaline mineral. So it's going to take calcium from where? Your bones. So what's the cause of osteoporosis? Soda, other acidic foods, sugar, anything, stress. I'm a bicycle racer. Excessive exercise causes what do we get? Lactic what? Build up lactic acid, right? So that's why we run and get some highly electrolyte type drinks, right? To try to replace those minerals that are being lost from our bones and from our muscles. Magnesium is stored. Where do you think magnesium is stored? Where it's used? In the muscles. It's in the muscles and the bones, primarily in the muscles. Calcium is stored in the bones. So we're going to leach out calcium from bones and teeth, right? So everybody got that? It's extremely important to understand that concept because we think, oh, let's just dump let's take more calcium. That is a problem. That's not treating the root cause. In addition, the body, what the body does, the body says, okay, calcium is highly and tightly regulated in the body. Tightly regulated. It only wants so much calcium. So the body says, once we start getting too much calcium, the body will begin to store it in places other than bone. Where do you think it's going to store calcium? In the joints, in the arteries, etc. So that is a problem. Okay? Now somebody comes in to see me and they have coronary artery disease or peripheral vascular disease, right? That means blockage in the arteries elsewhere. What's the first mineral I'm going to recommend for them? What's the opposite of magnesium? Guess what magnesium does? It dissolves calcium. It keeps calcium in solution. It basically breaks it up. So if you want the antidote, one of which, not the only one, the antidote for blockages in the arteries, magnesium. Are Americans, do they eat and or have an abundance of magnesium in their bodies or very little? Very little. Very little. Most Americans are deficient in magnesium. Some say as much as 90 to 95% of Americans are low in magnesium. The blood test we mentioned is a magnesium RBC test. The range is 4.0 to 6.5. 4.0 to 6.5. Where do we want our levels? 6.0 and above, in that 6.5 range. I have had 2 patients in the last 6 months who've had the highest levels in my practice. 2 patients. Did they supplement? No. They did not supplement. That surprised me. They did not supplement. When they told me they didn't, I realized I knew immediately how they were getting their magnesium. One was a woman and one was an overweight male. That should give you a clue. One was a woman and one was an overweight male, and they got their magnesium by eating a particular food source. Chocolate. The woman. I started chuckling when the woman told me that she did not supplement. I knew this already because she was a former patient of mine for over a decade. She said, "Oh no, Dr. Byron, I don't supplement." And I immediately started chuckling on the phone when we were reviewing her lab. And I said, I bet you are chocoholic, aren't you? She said, "Oh, Dr. Byron, you just don't know. I gotta have my little bit of dark chocolate every night." I'm like, yes. So dark chocolate is high in magnesium. That's why women, for example, may crave it during menstrual cycles. Right? Because you're losing blood, gotta have that calcium in your blood, etc. So have a little chocolate fix. Your body's telling you what you need. You gotta listen to your body. Dark chocolate. Not Snickers bar. No. So what you want is something like at least above 70% cacao. At least, and also you should consider cacao powder. You can mix it in a lot of cool things like coffee or whatever. Mix it in practically anything. I use it all the time, especially in smoothies in the summer.
What is it called?
Cacao powder.
Can you spell that, please?
CACAO. Cacao. You won't forget it now.
No, I won't.
Yes.
So, just an example, a friend of mine, her doctor told her to stop drinking gratuitous amounts of coffee, aside from the obvious issues with that. She was having kidney stones.
Yes.
So is that because the coffee is acidic and your body then dumps the calcium and then it calcifies in your kidney?
Amen. That's exactly right. That's 100% correct, except it's not just coffee. Okay?
That was one of the
right. It's not just coffee. Coffee is acidic. It is when I talk about acidity and alkalinity, okay? What the body wants to do, okay, here's I'm gonna explain that a little bit more. The body says, look, I cannot be acidic. I cannot be acidic because we cannot live with an acidic pH. Everybody understand that? pH has to be 7.4. If the pH is 7.0, 6.7, we are in the intensive care unit, either dead or about to die. Everybody understand that? The body has to be 7.4. So what's it going to do with that acid? It's going to get it out of circulation. Out of circulation. It's going to create stones and get them as far away from the blood, as far away from the core as possible. So it's going to create uric acid stones way out in the corner of the toe. Big toe, uric acid stone. He doesn't want it close to the core. Right? Get that acid out of here, get it out of here, kick it out of the house. And as far as you can go is the big toe. So people walk in with gout. Right? Okay, so what else? What else? Kidney stones. Right? It's trying to get it out. It's, well, how can we get this acid out? It's going to get that's the exit to the body. Exit out of the body. Kidney stones. Gallstones. What's the treatment for? If you Google gallstones, what's the treatment for it?
Apple cider vinegar.
Yeah, right. Keep going. Lemon. They'll say lemon, right? Drink lemon water in the morning. Why lemon water of all things? Because it is highly alkaline. Lemon and limes are the two most alkaline fruits that exist. So you want to alkalinize the body. Somebody comes to me with gallstones. When I first opened my practice, my first patient was somebody with gallstones, and that was her deal. She didn't want surgery. She wanted to get rid of gallstones. Were we successful? Yes. What was the visit? What was the essence of that visit? Alkalinize her body. And it's not just stop drinking coffee. It's a lifestyle. You have to live the lifestyle, the alkaline lifestyle. So if Chaz and I are exercising to the nth degree, that means we have to do everything else to the nth degree to cover for that acidic lifestyle of high volumes of exercise. You understand? If I'm working hard, pushing the envelope, that's an acidic lifestyle. That means I have to eat exceptionally well. I have to do my best to get enough sleep, etc. I have to make sure that I'm getting If I'm exercising, I'm on mineral supplements. There's no question, because I'm losing more than I can possibly take in through the diet. You understand? It's the lifestyle, not so much the individual little things, but the individual things do matter. Coffee, soda, etc.
Energy drink?
Energy drinks, it depends on the kind. I'm not a huge fan of energy drinks because if somebody using an energy drink, that's telling me right away they're not getting enough cellular energy. So why would they not have enough cellular energy? We talked about it earlier. I think you came in, maybe I can't remember what you were here. But cellular energy, why might someone be low in cellular energy? Thyroid, right? So I'm thinking if we have to supplement, we typically, as humans, will self-medicate. We're going to get what we need to survive. Doesn't matter how we get it, we're going to get it. So we're going to look for cigarettes. We're going to look for something to boost the energy. We're going to look for energy drinks, etc. My job is to sift through that and figure out what is the physiological reason and try to correct it. A few more minutes. Let's talk about a couple of other minerals that I have on the list that I deal with regularly. Silver is on our list, and I just kind of threw that in there for fun because we are in flu season. We're in the height of flu season right now. Silver is one of those minerals that is on the periodic table of elements, 118 elements according to my son. We need 60 to 74 of them every day. Silver is in fact one of those elements. And some people will balk, silver, Dr. Byron, come on man, where'd you go to medical school? You know. However, think about it. If someone goes into the burn unit or gets a second or third degree burn, guess what the prescription they're going to get from the emergency room? Silver's sulfidine. Sulfidine. I always pronounce it. It's a white pasty material. The primary component is what? Silver. Now who came up with that concoction? Right? It's silver. Silver is a healer. Everybody say that. Silver is a healer. Okay? It's a healer. It's a super powerful antimicrobial, anti-infective agent. So someone comes to me who we're in the midst of flu season, they're coughing, they're infectious, fever. One of the things that I will likely recommend is silver. And silver you can take in several different forms. The one that I like is a liquid form by a company called Angstrom Silver. That's my favorite. And that's distinguished from another form of silver. Most people are familiar with it. If you're familiar with it at all, it's called liquid colloidal silver. The only difference between, let's say, Angstrom and colloidal silver is that colloidal silver, which is perfectly fine for the most part, is a bigger molecule. It's like a beach ball compared to other size molecules like angstrom. Angstrom is a type of molecule that we use to describe the size of it. So angstrom size molecule. Angstrom will be the size of a pin tip compared to a beach ball, which is a colloid. Even a colloid is molecularly super duper small in and of itself. But when you start getting into angstrom size molecules, that's when you automatically bypass the gut, right? Because remember we need what to absorb these minerals? Stomach acid. So we're going to do our best to bypass the stomach by creating these super duper tiny minerals, almost nano-sized particles that really kind of exist in material form, if you will, that just automatically get absorbed into the gut and ultimately distributed fully throughout the body so that there's about 99% absorption from that form. And that's the form that I typically use in many, if not most, of the minerals that I recommend. So, silver. My wife came down with a little flu bug a few days ago, 2 weeks ago or so. She was down for a day. Typically, flu bug, someone gets the flu, they're down for 7-10 days at least. 1 day later, she was rocking and rolling as if nothing happened. One of the components that we used was silver. So,
I have a question about iron. I've heard that it helps with hair loss. I have Hashimoto's diabetes, and hair loss is a continual issue for me. And I've heard iron is good, but I just don't know what kind.
that's a good question. Again, so you can use the concept that we discussed today. Iron is not. I say it wouldn't be at the top of the list in terms of hair loss. Treating the thyroid in and of itself and optimizing the thyroid with the proper remedies would be probably at the top of the list. The Low iron is often an indicator of low thyroid. Now, why might that be? Same mechanism of absorption. Iron is a mineral, right? Iodine, which is required for the thyroid, is a mineral as well. If someone has low iron in my office, I'm automatically looking at the thyroid. That's automatic. So hair loss, also you want to look at things like other minerals that are involved. Zinc will be at the top of the list as well. Yeah, hormones play a role. Other hormones play a role as well, depending on your age and menstrual status. Sodium chloride, that's salt. I just threw that in there. Iron. Li, anyone know what Li is? What's Li is? Lithium, very good. Lithium. Guess what? Lithium is one of those essential minerals. It's one of those essential minerals. I threw it in there just for fun because many people would not recognize that as an essential mineral that we get from the earth. You know, do we need a lot of it or a little? Really, really trace amount, tiny amount. However, when lithium is low, that can lead to psychiatric problems like schizophrenia. So you'll see psychiatrists in particular prescribe a pharmaceutical version of lithium, right? So even the pharmaceutical companies believe you. They know this, right, Chaz? They know this backwards and forwards. So it's our job to learn this information as well, preach it, teach it, and live it. We are officially just past 2 o'clock, so I want to be relatively clear with respect to make sure I remain on time. Questions?
I did have a question. You talked about if someone has low stomach acid and then they need the essential iodine, zinc to help build that stomach acid, but then you said there's that double-edged sword where because it's low, they won't be able to absorb it. But then how do they build it?
That's a good question. It is number one, it's a slow process. It's a slow process. Being focused on it. Number two, utilizing the essential minerals that are in an easily absorbable form first. Get that built up by using, let's say, angstrom form of iodine and or compounded form of iodine. Compounded is coming from a custom pharmacy, which I use both. Angstrom form and or compounded form. Typically, my stylists do an angstrom form first because it's even more easily absorbed. So because you gotta have it. You gotta have it, and you gotta go slow with it. It takes a lot of time to build up stomach acid. So, angstrom form of angstrom form of iodine, zinc, vitamin B1, we mentioned earlier, is an essential component, which is a water-soluble vitamin, does not require stomach acid for absorption, doesn't require fat for absorption, easily absorbed, typically. And this, the lifestyle part, making sure you use sea salt for your food regularly to salt your food to taste. Do not avoid salt. Don't think that it's going to cause high blood pressure. It does not. That's another topic for an invitation next time.
So you need 6 months?
At least it depends on how deficient a person is. If someone, what I typically see, let's say a typical patient will come in and have a ton of signs and symptoms of hypothyroidism, have low iron levels, low magnesium level. I know it's going to take 6 months for that patient to get back, and it's just a matter of, as much as I want to put the pedal to the metal and say, oh, let's give you everything at once, it takes time because also we have to learn the habits of the lifestyle. It is bottom line a lifestyle issue. Yeah. So about 6 months at least.
So you did a very specific test for magnesium. What about iodine? Is there a specific test you should
Iodine loading test, but regular doctor won't do it. They don't
do it?
I won't say they won't do it. They don't have the capacity to do it. You have to have a kit that comes from a special lab to do
So
it.
it comes to you.
Yeah, you see me. All right, that's why I have my information on the sheet. You could potentially get an iodine RBC test. I've never done that because the experts don't really buy into it. So I follow the leader, and I'm not claiming to have invented the test. I just do what the experts say is the best test. So, yes.
So you mentioned all these different minerals. So if we, as supplements every day, take all these separate mineral supplements, would it be better if we took a vitamin that has all those minerals in it once a day?
That is a great question, and I should have brought some props with me, but I was running around with the kids today, so I didn't have time to bring them. But I do recommend a specific mineral blend There are some companies that make better ones, but this is a liquid. It's by a company called Byron. That's what I use in my office, what I sell in my office. That's what I take. I had my dose this morning because it's so easy to be deficient. So easy. Everybody practically is. If we lived a balance, if we had the minerals in our soil, we wouldn't need this. And if we lived balanced lifestyles, we wouldn't need it. But it's just so easy to supplement. It's relatively inexpensive.
It's called Vital.
Vitals Earth. Vitals Earth.
Oh, Vital.
Like vital signs, vitals hyphen Earth. Yep. That's the one that I recommend.
Where would you find
Is it
that?
vegan? Is it vegan? Is it
It
vegan?
is, it's vegan, yes, yes. It comes from the earth, it comes straight from the earth, no animals involved. It is what's called a combination of humic and fulvic minerals. If you're familiar with that at all, I'm not gonna go into it today, but the combination is excellent. You want the mineral blend.
Yes.
And that's the foundation.
Yes.
Just buy it online.
No, you can get it from my office, but you can't get it online.
Hey.
This is fascinating. I love this.
Just one last thing. In regards to the magnesium sulfate we do for the heart palpitations, that's what my wife deals with, and she tried pretty much everything. But everything that you're saying is kind of linked back to her thyroid because she deals with migraines and heart all the time.
Right, so here's the deal. That's classic. You need to get paid for that advice. It's right on. It's right on the money. So without giving you a firm recommendation, okay, the first thing, if I have to say one thing, it would be magnesium taurate. Magnesium taurate. Okay, magnesium taurate. So magnesium is the essential component, but there is an amino acid called taurine, and every patient who's had palpitations that was relatively speaking isolated, again, I get a magnesium RBC level, see what that level is, put them on magnesium taurate. That usually does the trick. But you can't ignore the thyroid, because the thyroid is sort of the big umbrella, and that is probably having an effect.
Okay.
So sometimes a person doesn't necessarily need magnesium taurate, for example. They might just need the thyroid plus a separate magnesium supplement like angstrom magnesium. I have a patient, for example, somebody has palpitations. I look for other signs and symptoms, palpitations meaning of the heart, I look for other signs and symptoms of hypothyroidism. And also, let's say I have a patient on magnesium taurate. That patient has high blood pressure. Guess what I just did 2 weeks ago? Got him off his blood pressure pills. 6 months, young guy, only like 35 years old. Off his blood pressure pills. He's on magnesium taurate.
Okay.
Came in with palpitations. Dr. Byron, my regular doctor, blah, blah, blah. Go. I just saw him for a follow-up this past week. Yes.
Okay, so back to the iodine thing again. I am terrified of iodine because I had an iodine test, radioactive iodine test on my thyroid, and I have Hashimoto's thyroiditis. I completely went hyper and started getting twitches and things like that after this test. So I'm terrified of iodine. How would I go about bringing in iodine with this terrible fear that I have?
That's a good question. I typically would recommend micro doses. So start low and go slow. That's my typical motto. So just to give you a range of iodine doses, the typical dose that I recommend for most patients, and this is according to the international experts, not our local doctor experts. Okay, so international. I'm gonna make that clear because if you go run into your doctor and say, Dr. Byron said, they're gonna say, what? I'll give you a quick example. The recommended daily allowance of iodine is 150 micrograms per day. Okay? Micrograms. There are 1,000 micrograms in 1 milligram. Okay? So 1 milligram equals 1,000 micrograms. U.S. recommended daily allowance is 150 micrograms. Japanese women, on average, eat 12.5 milligrams per day. The U.S. recommendation is 150 micrograms per day. You wonder why we're low. Okay? So they don't get breast cancer. Wow. Right. Okay. So how much do I recommend for my patients? All things being equal, 12.5 milligrams per day. Okay. But I recommend that for you in the midst of having been sensitive or sensitized to iodine. I say no, we would start you way low. You know, a quarter of 12.5 milligrams. And or, let's say if we started off with angstrom iodine, for example, it would be a quarter of a cap. Just a quarter of a cap, not capsule, it's a liquid. Cap, and the caps are tiny, the caps are small. So a quarter of a cap, I mean, just enough to, get your body used to it, etc. You know, radioactive, you got to be very careful with the body when it's so hungry for these minerals. A lot of people will have a detox reaction, right? The iodine, what happened was it's probably not the iodine, it was probably the bromine and chlorine. Bromine and chlorine come in and they're like the evil twins. So they look just like iodine. So they will come in and they will take over where iodine is supposed to work. Okay, all of a sudden I give you a bunch of iodine. Now that iodine is knocking off chlorine, it's knocking off bromine. And when that happens, now you get all these symptoms. You get a rash, palpitations, feel like crap, fever. That's because bromine and chlorine are being knocked off. Those are literally the evil twins. Bromine, chlorine, you find, and fluorine, by the way, too. Bromine, chlorine, and fluorine.
Triplets.
Yeah, triplets. You know. You get those, chlorine, obviously, you get in tap water. You know, fluorine, you get in tap water and toothpaste. You avoid fluorinated toothpaste.
Yeah.
And bromine, where do you get that? Baked goods. Baked goods. They used to put iodine in baked goods, and now they transition to bromine. If you go to Woodman's or a store that sells a lot of bread, spend about 10 minutes in the bread aisle and just look at the ingredients. And you'll see ingredients, especially for the natural bakeries. You'll see it'll say unbrominated flour. There's a reason they put unbrominated flour. There's a reason. It's not just like they're just being marketing it. They put it in there for a reason. For people who are health conscious to recognize that it doesn't have bromine. Yeah. Questions? I can't believe we went an hour and 15 minutes already.
So do you recommend not drinking any coffee at all?
Who asked that question?
Do you recommend not drinking any coffee at all?
Oh, that's a tough question.
Don't say that. Don't answer. Don't answer.
I'll tell you, this has been, I wish my wife was here. Again, she was running around with the kids today. One had dance practice, another had basketball. Because we've had a tug of war at home. It's tough. I mean, I think that what we should do is enjoy our food, enjoy our beverages, okay? So if it's necessary, if you feel like I really, really like coffee, okay, try to drink coffee with a reasonable amount. You know, 1 to 2 cups. You go beyond that, you know. The reason we have this conversation is that coffee is acidic, okay? But so is meat, so is every grain that exists, okay? So should you avoid those? Well, it depends. How alkaline do you need to be? You know, so if I have, for example, myself, I have about a cup a day, maybe half to 1 cup per day. And I have, that's why I supplement the minerals, okay? Because I have to. If I'm going to have that coffee, I got to counter it in some form or fashion, right? I can't just drink coffee, you know, have an acidic meal, work hard, come home, have an acidic meal, have a glass or 2 of wine, highly acidic, and go to bed. That's a setup. It's called a setup, right? You can't be surprised if somebody develops heart disease, arthritis, diabetes down the road.
So is decaf just as acidic?
Yes, it is. Decaf is just as acidic.
I do have a question, because I agree with 99.9% of what you said, but I didn't catch though that you said all of it right. So are you paleo? Are you?
I'm an omnivore and I shouldn't say minimize, I avoid wheat, gluten-free. Now, gluten, that's another topic, that's another whole topic, but that causes major acidity, major.
And I applaud all you people that were able to bring your spouses or significant others, because my husband is extremely diabetic. And when I'm a nurse and I start on him on all of this, it's really bad. I couldn't get him to eat seafood or go without coffee or not eat bread and I tried the whole, your alkaline acid, and he was like looking at me like, yeah.
It is extremely challenging, especially with those whom we love, and those who are close to us. Ultimately, the best approach is the slow approach with love. You have to have a lot of patience, you have to have a lot of love, and bite your tongue a lot. I mean, imagine me. I mean, I know a lot of information, and I have to be very careful at home, and I have to be careful when I'm out, for example, at Woodman's, because I'm just walking. I actually do the grocery shopping in the park because I like it, and I like, you know, learning new stuff and seeing what's in the aisles, etc. And I don't go in the middle aisles, but you know, it's important that we proceed out of love. When we proceed out of love, then we will begin to notice those changes. But if we're like beating people upside the head with the information, what are they going to do? You know, they rebel. So, you know, it is a challenge.
For the vital earth mineral blend, are children okay to take that?
My kids take it. In fact, my son who had a little sniffles the last couple days, triple the dose. So, one capful, which is 1 ounce for the minerals, is 1 ounce 3 times a day. But 1 ounce a day is perfectly fine. That's a maintenance dose. 30 ounces come in a bottle. So 1 ounce a day is your fuel enough. If you're an athlete and you're actively training, how many ounces do you think you need, Chaz? 3, right. If you're actively training, right, whole bottle. Right. Over here and then over here.
Okay, so real quick, just what's your take on organic produce versus the other thing?
That's a good question. First of all, any produce is better than no produce. And it depends on who's answering that question. For me, I'd rather see somebody have some produce rather than none, even if they're getting some pesticides and herbicides, We can get real sticky about that, but ultimately, I recommend organic produce, period, hands down. That's what I purchase. Any opportunity I have is organic, and I don't mind spending the extra money. I figure I spend money on the organic produce versus spending extra money on an insurance, elevated insurance policy. So that's where my money goes.
Yeah, I just was wondering, because people laugh at me because I drive 50 miles to Whole Foods to grocery shop, and they're like, hey, for what? They don't believe that there's really that.
Right, it makes a difference. I mean, you probably don't have to drive 50 miles, but you can, you can, if you search hard enough, you can potentially find what you need. Co-ops, for example,
Not in this area, though.
Yeah, I live in Racine, and I don't go to Whole Foods anymore because they take your whole paycheck.
Where do you go? I mean, Woodbridge doesn't have that great a slot. To me,
Woodbridge has a reasonable selection. I think I go to Outpost. Outpost has
well, that's 50 miles.
Yeah, I mean, I guess I'm closer because I'm in Caledonia.
Go to
Yeah.
Festival Foods.
Yeah.
Festival Foods.
Very
They
small
have more.
selection.
Yeah, so I mean, there are enough farmers around here to have, you just gotta look. So,
Yeah, and when there's market and stuff in the summer.
Right.
Sure, yeah.
I just wanted to vouch for the silver because my wife found out about it and her mother bought us some, and every time I even get a slight cough or anything, I take a little tablespoon of it, teaspoon rather, and I'm fine the next day.
Right, it makes a difference. I'll mention that the silver, for example, an extra, the FDA doesn't necessarily allow for labeling of silver,
Right.
such that it doesn't allow anyone to take it orally, or it won't be on the label. It says, use topically,
Right.
like the silver sulfidine. Taking it orally is safe.
Well, then,
Yeah, my 2-year-old daughter takes it, so
Right.
she
right on.
takes it. Yeah.
Yep.
years ago when there was the plague and stuff, hundreds and hundreds of years ago, people that had the water and stuff in silver vessels seemed to avoid the plague, and the poorer people that didn't have the silver were dropping off a lot faster than
Right.
those that had the silver.
Right, exactly. Any other questions? We'll take 1 or 2 more, then I can get a haircut.
Are you?
Chop off some minerals.
I'm trying to give myself on with coffee. I love it. I love the dark roast, probably the worst type of coffee. And I switched to tea, to caffeinated tea. Is tea acidic?
Yes.
Herbs acidic?
Yes, tea and coffee both are acidic, for the most part at about the same level. And there are charts on the internet. In fact, in my book the book is not published, but in my book I have several layers of charts for acidic foods and alkaline foods. Tea and coffee are both moderately acidic. And so let's say you have tea, yet your tea or coffee, your dark roast, you really enjoy it. You gotta have it. You feel good. Enjoy it. But don't follow that up with 3 glasses of wine at dinner, with the sedentary lifestyle, with, just make sure you drink plenty of water, good quality water, eat foods with highly alkaline foods for breakfast, have a green smoothie, you can count on it, you know what I'm saying? Just still enjoy the stuff that you really, really want. Don't go through life, missing your dark roast, I mean, you just gotta enjoy life. And by the way, one other thing I want to share, just reminded me of that. Exercise, guess what you lose with excessive exercise? All your minerals, right? You lose your electrolytes, right? Guys like us, darker skin, you can see it on our face, right? Salt, you're losing salt. You're not just losing sodium and chloride, you're losing how many minerals? 67 all of them. That's why Chad said he needs to take at least 1 to 3 capfuls or ounces, I should say, of minerals to supplement, if he chooses to exercise to that degree, right? Our kids in the summer, they're running, they're growing, right? They eat, sweating. Technically, they're supposed to get it in a diet. So, one more question, last one. 2 more. You go first.
Expand in your book and when the second.
2 months, I hope. 2 months.
That wasn't my question. What's the name? What's it gonna be?
It's called Eat Real Food. Yeah. I have it on my phone. Cool.
Where are you doing your book signing?
Yeah, I think I've been doing that so delicious. I do them wherever,
Well, can we follow you to know where you're going?
Sure, I guess you're telling me how to keep up with my Facebook page.
I love it.
Right. I'll become too acidic if I try to keep up with all that. Yeah, it's on the after card somewhere, and I thought I had a card. Oh, yeah, I don't wear my card.
I think you put them in your bag and we're out there.
Yeah, I don't know where they are.
Can we get
Maybe they're in my coat. It might be in my